Hello, I'm Seungweon Baek, a student from the Department of Physical Therapy, Busan Health University. I'm here today to present our study title, Immediate Effect of Different Stretching Posture on Muscle Viscoelastic Properties, Pressure Pain Threshold, and Cervical Range of Motion of the Upper Trapezius. My talk is structured as follows. First, the background and purpose, then the method, key research, and finally the discussion and conclusion of our findings. Let's begin with the background. The upper trapezius muscle is a common site for myofascial pain syndrome, and various interventions are applied in the clinic for tension relief and pain reduction. Stretching is often the first line intervention among non-pharmacological treatments. The effectiveness of UT stretching is known to vary depending on the posture and method applied. However, there is a lack of direct comparative studies on the effects of different stretching postures. Therefore, this study aimed to compare the immediate effects of posture dependent stretching method on upper trapezius muscle elasticity, pressure pain threshold, and cervical range of motion in healthy adults. Moving on the method. 34 healthy adults were randomly assigned to an experimental group or a control group. The experimental group performed a front ipsilateral cervical rotation stretch with a 1.5 cm support under the zygomatic region to maximize rotation, holding for 30 seconds. The control group performed a seated upper trapezius stretch involving deep cervical flexion and ipsilateral rotation, assisted by the opposite hand with the torso slightly tighter for 30 seconds. Both group repeated the stretch 4 times and lasted 3 minutes after the final stretch before immediate post-intervention measurements. Outcomes were measured pre and post-stretching upper trapezius muscle mechanical properties by myoton flow device, pressure pain threshold by a digital ergometer, and cervical spine range of motion using a CRM inclinometer. Next, we will discuss the results of our study. In the experimental group, muscle tone of the upper trapezius significantly decreased and cervical tension and ipsilateral rotation RM significantly increased. In the control group, both muscle tone and stiffness significantly decreased and relaxation time significantly increased. The pressure pain threshold significantly increased in the control group. Cervical range of motion also significantly improved in the control group. However, despite these within group improvements, no significant between group differences were observed in any measured parameter. Moving on the discussion. Our research showed that both methods produce immediate relief and improved cervical function, but there was no significant difference in the magnitude of effect between the two stretching postures. The simple prone stretch emphasizing maximum rotation achievement equivalence improvement compared to the complex seated stretch. This suggests that the choice of posture might be flexible in the clinical setting based on patient comfort. Improvement in muscle elasticity and RM can be impressive as the research of the creep effect, where short static stretching induces viscoelastic elemental relaxation and length increase in the muscle tendon unit. However, our study has limitations. The subjects were healthy adults and the sample size was small, limiting generalization to clinical population like MPS patients. Future research should diversify, increase the sample size, and evaluate long-term effects by adjusting application parameters. Conclusion. In summary, but upper trapezius stretching posture produce immediate improvement in UT muscle tone, decreased tenderness, and enhanced neck length of motion. There was no significant difference in effectiveness between the two methods. Thank you for your attention.